Right, moving on to our next series of presentations, we've got Dr. Stuart Jones from Action for Smoke-Free Communities. Welcome.
Oh no, we've got Cancer Society.
Oh, hang on a minute. Hang on. Oh.
Yeah, sit back down.
I'm terribly sorry. Actually, we've got everyone here, so it really doesn't matter what the order is. Dr. Jones, over to you. Action for Smoke-Free Communities. So the next 10 minutes or so is all yours.
Sure. All right. Kia ora. Thank you for letting me just come and present here this morning. My name is Stuart Jones, so I'm a respiratory specialist at Middlemore Hospital, and I'm also the New Zealand branch president of the Thoracic Society, which is the professional body of respiratory physicians and scientists in Australasia, New Zealand, Australia. And I just really wanted to speak to the topic of the smoke-free communities. First of all, I want to thank the Council for making this an important issue, because I couldn't agree more that we need to make our communities smoke-free. I'm passionate about breathing, I'm passionate about lungs, I'm passionate about people living long and healthy lives. And I think everyone here will agree with those sentiments. I do want to speak, though, a little bit regarding the whole aspect of e-cigarettes, because I think that there is a little bit of misunderstanding. E-cigarettes sort of came onto the market as a consumer product, and they still are a consumer product. But because of that, there was very little in the way of basic science studies done on these devices before they were launched. And now that we have a few more years under our belt, there's certainly a lot more evidence coming through in terms of what these things do in our airways. I've been involved over the last year with a TSANS position paper writing group, which is a group of about 30 people who have been scouring through hundreds of papers written since just 2017. So the amount of papers coming out these days is massive. I would refer all councillors and policymakers to the National Academy of Science report that was put out at the beginning of last year. The report is a full, comprehensive, balanced look at e-cigarettes. It's 600 odd pages long, but there is a nice summary document there with bullet points over 2 or 3 pages, which are easily to digest. And our goal for the TSANS position paper was to see what's changed since that NASM's paper, that we should change the recommendations from NASM's. Now, unfortunately, we only, the timing of this meeting means that the position paper isn't fully out, because we were only able to present it this last week at our main conference in Australia, and we're awaiting member feedback before it's released next month. But I think the take-home message that we see as a respiratory community is that there is no such thing as a safe cigarette, E or otherwise. And to think of these devices as safe, I'm sure all of us will agree is not a good way to go. So why am I saying that? It's basically because the e-cigarettes still do cause damage to the airways. The Federation of International Respiratory Societies, so that's the major respiratory societies of the world, came together when e-cigarettes were being touted as well, potentially a good thing initially when they came out, and 95% safer, and FIRS have unanimously said that there is no good data behind that statement, and that statement should not be used in encouraging e-cigarette use. The data for that, I don't have time to go into it, but came from a report of which there was a number of issues with the report, none less than the fact that the authors concluded at the end of it actually that there was very little evidence at that stage on which to base their recommendations. However, this is what they think, it's 95%. Be aware that vape is full of its own toxic substances and substances which damage the airways, various formaldehydes, various toxic aldehydes, depending on what sort of flavour you want to put in with it, will change the chemical composition quite significantly. And there's also a whole lot of metals that are also found in the vape. There is now clear evidence that e-cigarettes damage the airways. They impair the immune system, impair the way that the cells deal with bacteria, the airways deal with bacteria. There's clear evidence they cause inflammation and they damage the airway cells. And some of these studies are showing that the damage to the cells is to a similar level as combustible cigarettes, depending on what flavours and stuff like that you are using. There's a good study, for example, a good study published last year which showed, looking at the damage to the proteins in the airway, that e-cigarettes and combustible cigarettes shared a common pathway affecting about 30 of the proteins. Combustible cigarettes affected the airways in about 100 other ways just by itself. But there was there's about 115 individual ways that e-cigarettes affected the airways that combustible cigarettes didn't. And so what we're saying is that there's a whole lot of stuff going on there, and we are still trying to understand exactly how safe this is. They potentially do cause less oxidative damage, and they do have less known carcinogens in them, but they aren't carcinogen-free. And some of the data published last year also show a 5% drop in lung function over a 2-year period, which is about 10 times the annual rate that we should be expecting looking at middle-aged people, and at a rate that would be similar to what we would have expected with the cigarette smoking. So, am I anti-vaping? And there's a feeling out there that I'm really anti-vaping. I'm not, because I understand that stopping smoking is a complex thing. There is some evidence that vaping can help some people to stop smoking, and I think that that's something that we do need to encourage and explore. However, I would say this, that the strongest evidence for smoking cessation, use of e-cigarettes for smoking cessation, is in motivated quitters in a comprehensive counselling and follow-up arrangement. That's the study that showed the benefit the greatest. So these the patients weren't allowed, it was part of a wider smoking cessation counselling and supportive environment. And the other point that I would note is that the benefits will only be seen in complete switches. So dual users will still be damaging their airways with the combustible cigarettes, and they potentially will make things worse because they are now introducing a whole new array of changes that they can do in their airways. So we need to be clear at the messaging that if you're going to do this, make a complete switch. Don't dual use it. And ultimately, you'd want to make sure that the message was clear, that you'd want people to wean off the e-cigarettes completely to finally be doing no harm to the airways. The big study published last year, or maybe early this year, that showed the benefit for e-cigarettes and stopping smoking. 80% of them were still using e-cigarettes at the end of the year, so they're not completely free of damaging their airways. So it's just something to bear in mind. The other point that I raise here is that none of these products are currently FDA approved smoking cessation devices, despite the fact that they've been around for over a decade. None of the companies have gone through that process. One, I think, went to at one stage and then have subsequently withdrawn that. You've got to ask yourself why. The reason why is it's a consumer product. It wasn't produced as a medicinal product. And that the quit rates seen even with the most recent study are no better than our currently available medications, the Champax and the Zyban that we've got out there, which we know are 2.5 times better than the nicotine replacement therapy, which is what e-cigarettes were compared to in this study. and we know that these medications have gone through vigorous safety testing. So my other concern is I think we do need to protect our youth. I think it's fantastic how in New Zealand we've got such low rates of youth smoking, and it's great to see, but we need to keep them away from all these products. One of the reasons that New Zealand's smoking rates have come down is because of the lack of people taking them up. And that's a key thing, that as we try and get other people off cigarettes, we've got to make sure that we don't introduce new people to it. And the NASM's report from January that I flipped through, I don't know if that got sent round the councillors. Basically, the report in January, they went to review this evidence and they came back saying, yes, there is definitely a gateway phenomenon that occurs. Now, this is obviously in the States where they're in massive strife at the moment. You've got the Surgeon General saying that, in the midst of this raging epidemic of vaping in their adolescents, he says that it's the biggest concern in terms of the use of potentially addictive substances in the States at the moment. And so I think we've just got to learn from what's going on over there and be wary in how we manage things ourselves. So so just in terms of some things that we would recommend that we keep smoke-free areas vape-free because the effects of secondhand vape is still unknown. We're just trying to understand what the vape is doing to the airways, in primary inhalation. And so I think that we should be aiming to keep smoke-free, vape-free. We would recommend, strongly recommend this promotion, support, and enforcement of smoke-free areas within council, and including that as part of the council leases and things like that, to ensure that there is a strong message going out there. We would strongly encourage easier access to culturally appropriate smoking cessation support, and that's why I really like the aspects of this report that is coming through. I think it's really important that we engage members from within the culture to provide some of that support which is culturally appropriate. But I would push further, and I'd say that should potentially be a comprehensive smoking cessation advice that they're giving, where they've got access to current medicines which are available for smoking cessation, as well as as well as the whole e-cigarette or vaping as an option. I don't know whether this is, my last point is even within the bounds of council ability, but we would, in the initial Māori Select Committee report that was done to Parliament regarding smoking cessation, there were a number of factors which haven't been implemented in New Zealand. Tax was just one of them, but there's other things regarding changing the constitution of the makeup of the combustible cigarettes. That needs obviously national level action, but I do wonder whether some of their suggestions regarding the limiting of availability would be something that we can action as a local council. Limit access of cigarettes via specialist shops. I would argue that there should be R21 and follow what the FDA are now proposing in the States regarding the sale of flavoured e-cigarettes. And I think those are my bullet points. So I think it's great. I think it's a really important thing, but I think we should be just very careful about how we go about it, how we promote it, and what we do with it.
Okay, very clear. Thank you. Thanks very much, Dr. Jones. Now we've got probably time for 3 questions. We've got Councillor Stewart, Mayor Goff, and Councillor Darby, and Councillor Hills. Remembering we've got many presenters on this issue, yep. So I don't think we should target all our questions to our very first presenter. So, Councillor Stewart.
Oh, thank you for that. Very interesting. Would we be able to get a copy of your presentation? That's one question. It is on.
Yes,
It is
yep,
on the hub. Okay.
yep.
All right. So I haven't seen it on the hub.
Yep, I mean, I've purposely left that just in bullet points. I haven't drowned you with science in terms of p-values and papers and stuff like that. I'm more than happy to drown you with that stuff if you want.
And just on the e-cigarettes, I know e-cigarettes, and I know that the liquids and the vaping is, with the pipes is becoming quite popular in some countries. The use of essential oils, apparently essential oils can also trigger epileptic fits. Can you just tell us what type of oils are they actually putting into the e-cigarettes, and is that something that we also have to consider?
Oh, look, the main constituent within it is propylene glycol and glycerol, which are rather the rather benign structures in themselves. But what happens though is that they change chemical composition when they go through the heating process. I mean, some of the vaping devices, you can alter the temperature of it and things like that, and you can get 600 degrees. Some of them can get up to which significantly changes that chemical composition. So there's a variety of them, and I guess that's also part of the problem. When it comes to trying to regulate, you've got thousands of different flavors and stuff like that, and it's very hard to know what one individual flavor is going to do unless you study it, and no one can really keep up with it.
Thank you, Councillor Stewart. Mayor Goff.
Thank you very much, Stuart, for a really informative presentation. You managed to be passionate and balanced both at the same time, which is no mean feat. My question is a simple one. I take it from your presentation that you believe that smoke-free areas should therefore also exclude vaping, but I just wanted clarification of that.
Yes, that would be what I'd recommend.
Thanks, Chair. Thanks, Dr. Jones, for your presentation. I really appreciate it. How did e-cigarettes get to be rebranded in the more sort of with the more attractive name vaping? Was that by the industry?
Oh, I think it goes by several different names, ends products or vaping. Look, in terms of the branding, it's a commercial product, isn't it? It's a multi-billion-dollar industry. That's why big tobacco are going around buying out so many of the vaping companies. Even recently, Juul, who said that they were never going to side with big tobacco, are now owned by big tobacco and things like that. And so, big tobacco aren't silly when they see a chance to make some money. And this way, they get to take money off people, whether they're smoking combustible smokes or otherwise. So, it's a they will be and will continue to be very well marketed.
Okay, just one last question. From what you've conveyed in your presentation here,
yeah,
in our activity stream Switch to Quit, we have an emphasis on raising awareness of vaping as an effective quit option. In summary, are you cautioning us going down that route because the evidence is not yet in and peer reviewed on vaping, which is a relatively new, I think since 2007 it first appeared. Are you cautioning Auckland Council going down the route of promoting vaping as a tool to quit in light of the evidence not yet in?
I'm cautioning Auckland Council from making that the main message of that part. I think we should be getting culturally appropriate smoking cessation wraparound services of which vaping may be one aspect that the Smoking Cessation Counsellor will talk through with the individual and support through. Because, I mean, that way, you know, that's getting closer to what was actually shown in the studies as the most effective way of using it for that. But we shouldn't do that in neglecting what we already know are safe products that can be used to help people quit.
Councillor Hills.
Thank you, Madam Chair. I'm torn on this issue. To be honest, I was opposed to vaping being in public places before, and then heard from Māori and Pacific agencies around the need and the fact that when you're looking at more than a third of Māori and some Māori and Pacific groups still smoking, with all the media and all the changes and all the cost rises, clearly there's something not working. And what I was hearing was that vaping was a way through that. And if I look at the Ministry of Health and the WHO guidelines, they say vaping is, at the moment, what they've seen is far, far, far healthier, or there's less damage caused. So what I think it's all right for us to sit here and as ex-smoker to go on about smoking and vaping, but what do you think? You know, we're doing 1,000 million things, but how are you going to get those people off cigarettes? And if they're finding vaping the way through, should we not be trying our best to use that as an example? Because I know
I think we can.
part of it is
Yeah. And I think if people are going through a smoking cessation program and they've tried other things, they've in a supportive environment, and they think that vaping is going to be a good tool to use, I think that the council will be talking with the individual about the potential benefits of it. You know, as long as they're saying it's a complete switch, you don't want a dual use, and also work towards, you know, giving it up, e-cigarettes up completely would be the ultimate goal. But I don't see why that necessarily has to mean that vaping is allowed in public areas where there are non-smoking lungs being exposed to substances that they wouldn't normally get exposed to.
Thank you and good morning, Stuart. My near neighbour from Wattle Downs. Good to see you. I hear the argument that you're applying in relation to smoke-free. Would you apply that same argument in relation to the smoking consumption of cannabis?
Yes, that's another talk. Yes, but yes, yep. Again, from a respiratory perspective, from an airway perspective, there is good evidence that that harms the lungs, and so that's what I would say. Yep. And I think part of the problem with the whole cannabis debate at the moment is people are confused between medicinal cannabis, in which the cannabis has, well, it's been refined to get the right mixture of the cannabinoids and things like that affect the receptors to be useful with the pain and things like that. So in palliative care they use it and things. That's quite different to smoking a joint. And I think it's just confused public on a national level, having both these debates going on at the same time, because they hear medicine people are saying that it's okay. Well, yes, the refined oils, things like that are used in palliative care settings and things like that, it's quite different.
Get the former for the palliative care, but the latter is not good for your health and you shouldn't do it.
Correct. Yep.
I think this is out of scope.
Yep, out of scope. Yep.
Discussion. So.
I'm happy to come back and talk about cannabis another time if you want to.
I'm sure Councillor Newman will be very keen to discuss it.
Yeah.
So moving on to Councillor Bartley.
Thank you, Madam Chair, and through you, thank you for your presentation. I was just looking at our report, and it says that there's no robust evidence that vaping presents secondhand health risks. Are you saying otherwise? And have you got something that we can use to back that up? And also, it also says that we don't have any robust evidence that it's a gateway to smoking, yet your presentation clearly says that there's a NASM report from January that says e-cigarettes have become a gateway to smoking. Could you
Yes.
please clarify that? Thank you.
Yes, well, in terms of the gateway to smoking, the NASM's report from January clearly states that it is, and it's something that we need to be aware of. In terms of the effects of secondhand, the truth is we don't know. We are just understanding what primary inhalation of vape does to the lungs, let alone so we're not at the second-hand exposure level and things like that. However, if you are around people who've vaped, you can taste the vape, you can taste the chemicals, and so it's not going to be negligible. There's going to be stuff there that you're inhaling. We simply, correct, there's no evidence that it causes damage, but that's simply because that evidence doesn't exist. There's no evidence either way of the effects of secondhand smoke. I mean, let's remember that it took us decades before combustible cigarettes were linked to the airways and damage to the airways, and COPD and lung cancers. That all happens years out. And I guess what I'm saying is that the basic science studies that are coming out now are showing that these things are affecting the airways, and they aren't going to be safe to continue to keep using. They're not going to be as good as just breathing air.
If I could just ask one more question, please, Madam Chair. So would your,
Just before you ask a question, Councillor, I'm just aware, and I've still got Councillor Fletcher, we are loading all our questions onto one presenter. I'll just give our other presenters a chance to think about maybe this is some material you might not need to cover again. Councillor Bartley.
Thank you, Madam Chair. I really want to ask you, because you're a doctor and you're a specialist in this area. So would your advice be that since this is quite dubious, that we leave out the promotion of vaping? Because, I've heard, when in doubt, leave it out. Clearly, there's a lot of doubt here about vaping.
Yeah.
So is your advice that we leave it out?
Yeah, look, and to be honest, this is where I'm torn, because cigarettes are, I just hate them. And if it was up to me, they'd just be completely banned. But I know that I'm not allowed to do that because of personal rights and things like that. I just live in the damage of it. So I don't think it needs to, but I do recognise that for some people it can be a good tool, and I don't want to remove that option from that person. So I think that we shouldn't actively promote it as the main end game, but we should promote it as part of a broader, wider, comprehensive smoking cessation service.
Do you think that that's what we've already got in this plan?
I was concerned that it was too strong in terms of its vaping content, and vaping's going to be the wonder product.
Thank you, Madam Chair.
Well, thank you, Madam Chair. To a degree, I think my question is asked in terms of applying the precautionary principle here. I'm happy to move the recommendations, and I would ask that instead of just thank him for his attendance, to add there, thank him for his advice and attendance.
You may have to arm wrestle Councillor Simpson, who already signalled that she wished to move this. So
I don't want to be precious over it. I'm quite happy for anyone to move it.
Okay. Councillor Simpson and Councillor Fletcher. Thank you. And Councillor Simpson, you wish to ask a question?
Very tiny question, thank you. If, in your professional opinion, when people come to see you, do they think that if they're vaping, they're smoking?
No.
The second question, supplementary for me, in talking to people who don't smoke and have someone beside them who is vaping, and the person who doesn't, and the non-smokers opinion for the people that you deal with? Do you think that they're sitting next to someone who is smoking?
I've had a number of complaints from people that it irritates the airways of the non-smokers, and including sort of asthma and things like that in some children.
All right, it's been moved and seconded that we warmly thank Dr. Jones for his excellent advice and presentation.
And I'm really happy to be involved in further discussions or questions if people have it. I think this is a difficult thing to get your head around and know what to do.
And I think that's why it's good to have the time to put into it. So I'll put that. All those in favour, please say aye. Aye. Against? Carried. Thank you.